And like Andrew had said, that, our patients are looking on the website to see how we're doing. And with that, we have our nurse manager, Jeannie Banton, who's going to talk to us about the importance of patient experience, and we can't stress that enough. So thank you, Jeannie, and welcome her to the podium. She's going to be talking about advancing patient experience in a high-volume cath lab, and they do a great job. So thank you, Jeannie.
Thank you. Good afternoon, everybody. My name is Jeannie, and I am the nurse manager of the Cath and EP labs here at Mount Sinai. I'll be, as Beth had said, I'll be speaking about the enhancing the patient experience in a high-volume cath lab. And here, I have no relevant financial relationships to disclose. So our patient experience mission statement for the Mount Sinai Heart is "Where you're the heart of the matter." In the cath lab, we take this statement very seriously, and our number one priority is to optimize patient safety, experience, and quality. As one can imagine, coming to the hospital for any reason can be daunting. Patients have all sorts of questions. The most stressful part is, of course, the not knowing. We have maintained the Platinum NCDR Award for chest pain under their MI registry since 2020. The American Heart Association's Get With the Guidelines Gold Plus Award for STEMI receiving since 2021. And to add to this, the cath lab at Mount Sinai has achieved the American Association for Critical Care Nursing Silver Level Beacon Award for Excellence, which highlights exceptional patient care and commitment to improving patient outcomes. Last year, one of our nurses, Heidi Go, received the prestigious DAISY Award. The DAISY Award is given to a nurse who has demonstrated extraordinary, compassionate, skillful care. In the nomination letter, the family stated that Heidi's uplifting and supportive approach simplified a challenging recovery. Heidi's focused on every important detail, especially when her husband tried to walk and felt faint. With professionalism and tender loving care, Heidi opened up a space of healing because she was able to take care of all the details. So I'm sure you've all heard about OAS Caps, but that's really for inpatients. Procedural areas like the cath lab have what we call the OAS Caps. This stands for Outpatient and Ambulatory Surgery Survey Consumer Assessment for healthcare providers and systems. Of course, that's a mouthful, so we just say OAS Caps. Patients are provided a survey to take once they have been discharged home and are asked to rate their experiences. At Mount Sinai Heart, we have a multidisciplinary monthly meeting to review our patient comments. Here are some of them. Felt very cared for and in professional hands. Every individual that interacted with me during my Mount Sinai experience was excellent. It was extremely well done procedure. The staff knew their jobs and did them beautifully. My surgery went flawlessly and I felt no pain at all. I couldn't be more pleased with the outcome. The whole staff should get commendations. A great team effort. My doctor was exceptional. I had a great experience. The doctors, nurses, and the staff were super good. Everything went well with all events. Very professional team. All expectations were exceeded. Well informed and no surprises. Thanks, guys. My experience was great. My experience was a great one. So many respectable and comforting staff, all from beginning to the end. And I was very happy that I was at Mount Sinai Hospital. Thank you. I was terrified, as usual, but everyone was extremely patient with me. Everybody was helpful the minute I walked in. Staff was very polite, explained everything step by step, in which I understood everything. I will recommend this hospital to any one of my family and friends. Excellent care. Wait time before procedure, longer than expected. I was a little unhappy with the wait time before my procedure was done. Miscommunication regarding time. However, staff was very good and professional. As you can see, many are good comments, but we are far from perfect. We strive to take every comment to heart and improve on it, especially when it comes to communication and wait times. We understand that what is routine for us is very stressful for our patients. Some of the ways we reduce stress is by being focused on our patients by patient communication, and expectation. Our procedural nurse calls the patient and provides them with directions to the registration area as well as instructions for the procedure. As you can imagine, wayfinding at Mount Sinai, because it's so large, can be daunting. We are a very busy lab, seeing about 75 patients a day. There's constant movement, and patients may not understand why this other person in front of them was moved before them. Frequent routing by our liaisons and nurses to provide updates on any delays that may occur, especially due to emergency situations, are very important so that we can reduce the fear of being forgotten. We are mindful that while patients may be sedated, they are still awake. Talking to the patient, especially during the prep portion of the procedure, is essential so that the patient knows what is happening. For example, telling the patient that the cleaning solution is very cold and may sting a little bit can prepare the patient for this unpleasantness, especially if they're about to drift off to sleep. Our patient liaisons are an integral part of the Cath lab staff. They have a vital role as they are the point person to contact for our family members. This is Gidget. She's one of our 3 liaisons. Gidget creates a relationship with the family and patients as soon as they have been registered. An exchange in phone numbers is done so that if there are any questions, she can easily answer them and easily be reached as well. On the short walk from the registration area to the ambulatory area, Gidget engages in conversation with the patient and family member. This impromptu picture shows Gidget assisting the patient by carrying their bag. Our liaisons have been invaluable in keeping our patients and their family members informed on the procedure performed. As one can imagine, a patient who has just finished their Cath procedure may not remember the conversation with the proceduralist or even the discharge instructions due to a number of reasons, stress and sedation being the main ones. Both our nurses and liaisons ensure that family members waiting in the waiting room are notified as soon as the procedure has been completed and allow a brief visitation with the patient. It is also at this time that the family member will speak to the proceduralist if they choose to. Patient comfort is always a priority for us. Warm blankets, snack boxes, TV, and tablets are all available for our patients. We have a close collaboration with the environmental services team to maintain a clean and therapeutic environment. We cannot assume that a patient is comfortable. Every team member, PCA, nurses, fellows, liaisons, even the environmental services team, are all involved in ensuring that the patient is comfortable. By engaging with the patient, we can obtain their perception of us and our care. Interdisciplinary communication is an essential component to creating a positive patient experience. Communication promotes patient safety and provides reassurance at each step of the way. Whether it is transfer from the individual care of a team member or our communication enhances the patient experience. Patient experience does not stop when a patient is not in the lab. It continues on the inpatient units and at discharge. As Dr. Kinney and Andre just recently spoke about, our STEMI app is a prime example of our interdisciplinary communication because it includes the emergency room physician, nurses in Queens and just downstairs in our ED, the transfer center, our own Cath lab physicians and nurses, as well as throughput. This occurs in real time in order to facilitate swift transfer of the patient, especially when every second counts. Every morning after board rounds, we also send out an email to all telemetry units and heart ICUs detailing an approximate time that an inpatient may be brought to the lab. We also have group chats with our various inpatient units, so we can provide up-to-date information to our patients as well as our add-on cases. This helps these patients know when they can have breakfast or lunch and allows them to communicate visitation times to their families as well. We are also in constant communication with the housekeeping department so that we can ensure that our inpatient beds and our outpatient areas are cleaned in a timely fashion. Our nurses help to continue the positive experience for our patients by discussing the plan of care and what to expect on our inpatient units. The recovery room nurse introduced the inpatient nurse who will be taking over their care. When transferring a patient to the inpatient unit, the nurse maintains face-to-face contact to encourage a dialogue to take place. Once on the inpatient unit, bedside handoff between the recovery nurse and the inpatient nurse occurs. The patient is also able to participate in the process and allows them to ask questions. For our patients being discharged from the lab, instructions are given to both family member and the patient to ensure that there is someone other than the patient who fully understands these instructions. A written copy of these instructions are also provided so that the patient may refer back to them when they are at home. The day after discharge, a nurse will call the patient to check in on them. Were they able to get their medications? Do they have any questions, any issues? If there are any issues, the nurse will escalate to the nurse practitioner who will attempt to solve the problem for this patient. Our most recent initiative in the Cath lab is our Commit to Sit initiative. Our recovery area is small and somewhat cramped. As a result, the energy perceived by the patient can easily be misconstrued. Our Commit to Sit initiative was started in March when our OAS Caps showed that only 71% of our patients reported adequate instructions regarding recovery. In response to this, we wanted to provide a holistic environment where the hustle and bustle of the recovery area so that the patient may focus on the instructions we are providing to them, and also provide a time to ask questions. As you can see, there was a marked increase in our satisfaction score in March, but it dropped again in April, with a slight increase in May. It shows that while we are still doing better, we still have a lot of room for improvement. Finally, teamwork is the foundation of our care, where when a team works together, they can provide care to the patient that appears seamless. The patient will be at ease, knowing that everything will be taken care of. Thank you all.